Before I got sick, I did a lot of physical activity, almost whatever I could. Got bored sitting at home pretty easily. Favorite sport was either soccer or basketball. But I also loved free diving and boogie boarding and snorkeling. I loved being at the beach. I just have countless memories of beach bonfires and always being down there. There was a pool we had that was kind of our little special place that we went with our family friends to have dinner, either pizza or chicken nuggets or something. So those are some of my primary memories.
So Alex was a super energetic, extroverted, happy child. He was always on the go. He loved to play sports. He loved his friends. He loved life. And he was very sensitive to other people's emotions. He was an empath. He cared about people. He cared about his friends and his family. He was in first or second grade when I started to see signs of what I felt like was too much fatigue around seasons. When in the fall seasons, I started to see a pattern of fatigue and stomach aches, and his skin color would look poor. He was pale, and he'd have kind of bruised eyes. I had a history of chronic fatigue, and had spent a few years really struggling with my health. And so I started to draw those parallels, but then also tried to distance myself from that. I didn't want to know that was a potential to pass on to my child.
I started not feeling well. It's all kind of mashed together. But I remember vividly pretty sure it was fourth grade when my teacher started to get concerned with how many times I was going to the office for being sick or kind of missing a bit of class.
We started with acupuncture. We found success with NAET. We did some chiropractic. We went the alternative route at first. It was recommended to get allergy shots when he was starting fifth grade to help with the allergy symptoms, and that was our final straw. He started. He responded in almost a catatonic state, I described one evening after allergy shots, where we ended up at the emergency room.
My body reacted extremely poorly to those. And there was one night where I was just eating some Cheerios because I didn't feel well, having some cereal, and then I all of a sudden just started feeling awful. And I went to the couch and it was a combination of a very negative reaction to the shots and just probably one of my worst, if not my worst, anxiety attack I had I was almost kind of like, I wasn't really interpreting or comprehending anything.
This was actually a frame grab from a video I took in desperation because he started violently retching for hours at a time, days on end, and just in almost a convulsive state. And our pediatrician was not able to do anything. I had to ask to be referred to a gastroenterologist. That took probably 6 weeks. He wasn't eating. He was a kid, and I remember thinking, as an adult, I remember that feeling of how it felt to be turned away by the medical field, but I never thought it would happen.
For me, the reason it was so hard as a kid, when you're younger, you kind of expect doctors to know everything. Like, it's like the doctor is the savior, an hour a day, like an apple a day keeps the doctor away, but you still gotta go to the doctor to make sure everything's okay. And when I really started to realize that the doctors didn't know what was wrong with me, that's when I started to get scared as a little kid.
To start getting referred to specialists, and we went to gastroenterologists. We got the diagnosis of celiac disease, but going gluten-free didn't resolve his problems. We went to Stanford for many months. We went to Mayo Clinic for 2 weeks. We went to Chicago to see a doctor in Chicago. We went to University of Chicago. So we spent about a year doing the hospitals, and I just added up this number. I didn't want to do it, but I did. I'd say we're safely. We spent about $150,000 over the 3 years.
It was kind of obvious to me that the doctors, it wasn't, after all the specialists we saw, none of them really gave help. Some of them were even, I feel like, a negative effect on me. They're saying, oh, he's just gonna have to cope with this. It's probably gonna get worse, or are you sure you're not making it up because I'm a little kid? It almost felt like turning their back on me.
Nothing really shifted. He would feel a little bit better, and then and then it'd all start back up. And so every single treatment we would do, we might see a little bit of shift, and then it ended. It was incredibly frustrating, and the part where it really became quite frightening, doing the balance between taking a child of that age to hospitals and doctor's office nonstop, it became his life, was how much more do we subject him to these tests. So doing that balance of accepting a new normal, and also continue to pursue what was wrong. And when we hit that point where Alex we were afraid for his life, he became a shell of himself, and very quiet and very little emotion. The anger and the fear. He slowly started to confide that he didn't want to live anymore, that he didn't see how this was a life. He didn't see a way out, and he felt he was a burden on his family. I first heard about the dynamic neural retraining system from our chronic fatigue doctor, Dr. Jacob Teitelbaum, and he had treated me successfully, and I was about 90% better, and he recommended that I take the program to finish off and get 100% better. And I looked at it and I thought it looked great, and I was planning on going, and then my son got sick. And Dr. Teitelbaum also treated him and recommended the program for him. So we got the DVDs in November of 2016 and spent Thanksgiving break doing, we took about 10 days to do the DVD program together.
The DVDs did really inspire me while I was watching, but it wasn't that long before, like almost later in the day, I'd kind of completely given back up on it again. And after the DVDs, which was the first thing I was exposed to, I did practices pretty religiously for about, I'd say 2-3 weeks, but then I saw some results, but I just it was still, my cognitive wasn't back, so I kind of just gave up on them and said I was doing them just to make my parents happy. And it wasn't until my mom, about a month and a half later, after watching the DVDs, went up to the seminar.
So I came back from the seminar in Ojai and sat down with Alex and told him about the people I saw there, that this was the real deal, that Alex's experiences were not unique. He wasn't special, or there's a lot of special people out there. And to be perfectly honest, that a lot of people were much sicker than he was and had been sicker longer. And to see what was happening and what was shifting over those few days in this group and in myself and my sense of beliefs and how that would relate to Alex, and how intertwined our neurology was. That was incredible.
That's what really said, all right, I have to do this. I can't pretend to do this and make people happy forever. If I want it to last, I actually have to recover for myself and for my friends and family. So I would definitely say the hardest part's going to be the practices, but you will see results eventually, even if they're little bits at a time. What's different about the results from the practice is they very rarely go away, whereas when I was going with the doctors, they would do something, it would help maybe for a couple weeks, maybe if I was lucky, like 2 months, and then it would go right back. And that didn't happen for me with my practices.
The whack-a-mole game ended. Yeah, that's what we
saw results that wouldn't have to deal something I had to deal with as much anymore, so I could focus on other things. So that'd be my biggest thing. And then hiring a coach was extremely helpful, especially since all the coaches have pretty much been through some sort of thing where they can relate to you, they can give you advice, and it was incredible. So I was always practicing. I would practice right when I woke up in the morning. It was the first thing I do. Maybe I would get out of bed just so I wouldn't fall back asleep and get some water. Then I'd go back, and for like an hour, I would just practice. And then whenever I tried something new, because one of the first things I learned through the dynamic neural training system was I can push myself, and just because I'm feeling symptoms, it doesn't mean I'm destroying my body. So I very quickly started exercising again and being physical, and that really motivated me to keep doing my practices, because to keep myself from getting symptoms after I would have to practice. And that was the big kind of up and away moment where I felt hope.
The thing that blew me out of the water, that just I could not believe it, was when he started experimenting with gluten cross-contamination. And he was able to go into people's kitchens and have no reaction. Fortunately, he just stuck to it. He really, really stuck to it, and we saw the results fast enough initial results fast enough. But again, I want to emphasize that he was very symptomatic for a long time and worked through that and did the hard work. And the peeling the onion, this was our coach, gave me this analogy, and really for me stuck with me. I know there's a lot of talk about, the ebbs and flows and the steps forwards and the step back. And our coach really encouraged us to look at it as like peeling the onion, and it just made so much more sense. He would, these top layers would fall off really quickly, and then we'd hit a lower layer and maybe a thick layer and a hard one, and they would come back because we were dealing with another layer, another trigger, and so it became less of the step forwards and step back and more about just these things were falling away, and we had to come back and hit some of these really hard things.
My sensitivity to mold was one of the first things that really did decrease. Showers, just warm showers weren't enough to trigger me. I was still slightly sensitive to cold water, but that was something that really came back quickly that I was able to do. My sensitivity to cross-contamination and gluten and other food allergies did recover fairly quickly. And the only things that really took a long time to recover were the chronic nausea and brain fog.
First, the summer, for us, when everything just really came together, was summer, and there was this frantic, go out and live life. And we just plowed, it was breathless. I mean, we just went and had a fantastic summer. And then the summer ended, and it was time for school, and he had to start school, and that took some adjusting. And now it's stuff that I used to dream of.
I ended up actually finishing my first school semester with a 4.0. I thought I was gonna. I was aiming for I was aiming for a 3.
So I've been thinking a lot about jobs and colleges, and I got my first job, and I'm starting to train for that. So I'm excited to really be more independent and being able to not have to have other people support me.
And then, the next big hit was when he started football practice, 3 or 4 hours a day. I sat through he wore me down. There was no way. And interestingly, not typical, my husband was so disappointed. He was like, I can't believe you caved. And I'm like, if you're going to be the one who's you can try. I sat through that first practice. It was the middle of the summer, watching him do wind sprints, running, and just had no idea if he was going to be able to hold up to it. And he just did it. And I'm getting to, have freedom in my life, and so is my husband, and we're relaxed about things. And, when somebody has a bad day, it's just, there's no more living in fear. And the person who gets missed from the story a lot is his younger sister. And Alex and his younger sister, Lucia, are incredibly close, and she suffered greatly through all this because she saw it all. And she's also witnessed the recovery. And she used to spend a lot of times when he was sick talking about the good old days when we got to do this and that. And it's been just a pleasure to watch her be able to be a little girl again, and life is normal for her. There's just no more living in fear. And there's just a tremendous amount of gratitude for just the normalcy of life.